voice. You ready?
Yeah. I'll try not to do that.
Hey, we are here with Mark Nelson, who actually is a veteran. Mark, it's unfortunate for us to have to accept this time of our lives,
Yeah.
but we're now the veterans. And when you and I entered pharmacy, I think we entered in the same time, about 2009 ish.
Yep.
We were like, what, other than we thinking we knew what pharmacy was, but you played a very special role in the evolution of pharmacy technology and in pharmacy systems. And there's experiences that you have. We're always so intense where we're trying to serve our customer. We want the independent pharmacies to evolve and leverage technology, but there's stories within those years of service and the years of looking out. And I just want to hear from you. And if the listener doesn't know, you've been part of this industry for quite some time. You've learned a lot, and now you're vice president of pharmacy services here at Outcomes.
Correct. Yeah.
And just share with a little bit about yourself and in your story.
Yeah. So I guess we'll start at the beginning. I entered pharmacy in 2009, and like you said, I didn't really know anything about pharmacy. I was kind of a nerd at heart. I think I
Me
focused
too.
on IT, and so when I had the opportunity to join a company and help build a product for community pharmacy, so I'll give it a shot. Um, Interesting, the point you made. It's my entire career has been helping pharmacies embrace change.
Yep.
Because even from the very beginning, we were coming in with this new revolutionary product,
Yep.
and we were met with a great deal of resistance up front because, well, this is the way I've been doing it for 20 years and it works. So why would I change?
Yep.
So we're coming in with medication synchronization, and it's this mind-blowing thing at the very start. And so you're kind of having to lay the foundation to say, what you're doing isn't going to take you into the future. You have to embrace the change, and here's why. And really, that's been the story of my career. And I think that's a trend within community pharmacy. It's always there. What's that next thing that's going to help set these pharmacies apart? And so, yeah, that was the first 10 years of my career, and it was an amazing experience. I after that role, I don't know if I should actually say it or not on this podcast, but after that role, I joined a company called Gartner, which was phenomenal from a personal growth standpoint. So for those that don't know, Gartner is a global healthcare analytics and IT analytics company, but 40,000 employees across the world. Just so much different than working in community pharmacy. But the experience you get from that is, here's how a very well-oiled machine operates. And here are the guardrails that they put in place to make people's jobs very efficient. And I think there was a lot of synergy with Outcomes. And so when they approached me, it was like, hey, I've actually not been directly within independent pharmacy here for 3-4 years, but I love it. And it's, and I will say, like, every day I'm on LinkedIn looking at, like, what are all my friends doing? What are those people that I formed those relationships? And it's something that I'm just truly passionate about. These are my friends.
Yeah.
And I think that the great thing when you're a vendor in this industry is you actually play a critical role in helping these people, like, accomplish what their dream was. I want to open a pharmacy and support my community and support my family, make people healthier, and be successful in the process. And when you get to be a part of that journey for someone, it's not to be altruistic about it, but yeah, I'm selling something, but it's easy to do when you know that you're doing good at the same time.
Yep.
And so, yeah, Outcomes approached me and transparently said, hey, we're trying to flip the script, no pun intended. We've got this new vision. We have this product called Outcomes Premium, and we're focusing on the clinical and medical billing and just a different approach. And so there's a lot of synergy between my previous experience, right? Is take all this new technology and then help not convince, but show people why they need to embrace that change. One of the things that I've said kind of my talk track with my team is why this is important and why I really wanted to get behind this and be a part of this team is that if my previous experience was all about filling prescriptions, how to do it easily, efficiently, and how to have all those tools in one place. But if I fill 100 more prescriptions today than I did yesterday, I mean, realistically, that's not really moving the needle entirely. It can become a staffing capacity issue, just bandwidth, cash flow. There are a number of challenges on it, and reimbursements aren't phenomenal.
Yeah.
In a lot of scenarios. But if I can start doing point of care testing and medical billing, and let's say you do 20 of those in one day, like that can be game changing to the pharmacy. And so that's what I'm here doing is trying to take pharmacy to the next level. We think the future is clinical and help them. Still got to do all the filling, and that you still need that portion.
Yeah.
But when you add the next phase on, like it's pharmacy as a healthcare provider, which they've already been doing anyways. You just need to get them recognized and paid for it.
Mark, I don't know if this is controversial to say, but maybe it's not even pharmacy anymore. I mean, pharmacy's been my life for 20 years, but maybe it's community health, because we're moving away from the dispensing fee as the only way of getting paid, and we're doing pharmacies in the community, independents that are here at ThoughtSpot. They're committed to their communities. They're part of the communities. They're supporting. They're showing up on school boards, or they're showing up at city council, and they're really part of the community. But their infrastructure is no longer just a pharmacy. They're doing immunizations. They're doing disease state management. They're doing, and if they don't have a program like Outcomes to pull that data in and get paid for it, they can't evolve. But I wonder, the word pharmacy to me, the layperson doesn't understand this. It would be us inside the industry, the people listening right now, you'll get this. And that is, pharmacy isn't what it was 20 years ago when you and I entered the space.
No, nothing like it. And I've said that, like, pharmacy is not what it was 2 years ago or 5 years ago. Like, it changes because you're taking something with technology, which, I mean, it's hard to keep up with AI and all these new things. And then you're laying it over top of pharmacy with constant rules and regulation changes. You mix those two things together. Like, they're focused on running their businesses. And so that's where you can be like that trusted advisor consultant to say, like, here's this other thing you need to be focusing on. But I love the way you said it, because that is truly how I look at it. Like, you're not just a pharmacist. And I have people say, well, like, well, I'm just a pharmacist. Like, you're not just a pharmacist. Like, I can access you so much easier than my general practitioner. Like, I trust you. And I think that's the way these people's communities feel about them. Like, they're kind of, part of their families. You hear those stories all the time. So, no, I love it. I think it is community health. It's a better way to look at it.
Community health.
Yeah.
Yep. So your mission here at Outcomes, to take all of your experiences. You also did some consulting with an independent consulting group that helped pharmacies kind of like think outside the box.
Yeah.
So all this is now rising up to that leadership position. So I want to shift the gear and ask you about leadership.
Yeah.
When I look back in my days, I would look at Jeff Key, leader, people, the Irene family from Specialty, leader. And then, but we have to now look at ourselves in the mirror when we get up in the morning and be like, you know what? It's my turn to lead, because I kind of have to. If you're going to be part of this industry, if we're going to be part of this profession, it's our turn to step up and take all these years of what Jeff taught you and what the Irenes taught me and what Jeff, I mean, I think of Earl Hutchison from the Soft Writers days. I mean, he's passed away since, and all these people that I stood on their shoulders to get to the next level. I want to keep doing that for other professionals.
Yeah.
And I want to shout out to the whole Outcomes team, the young people on the team, the older people on the team, doesn't matter. Realize that people like Mark bring so much more to the table from what our experiences have been than selling a pharmacy management system or selling technology. We've soaked in this entire profession for 20 years. I mean, that's a lot of experience.
Yeah.
No. So talk to me about leadership from your perspective.
Yeah, no, I like the way you said that. Jeff Key was a phenomenal.
He's a legend.
Yeah, absolutely. amazing mentor. That's the best way to say it.
The
And
reason why is I trusted where he was coming from. I competed with him. I competed with Pioneer back in the day. I competed with the RX-30 team back in the day. But I trust that what his end game was empowering a pharmacy.
Yeah.
And that was the part that I would stand back and be like, that's freaking cool. Like, I want to have that reputation someday.
yeah, no, it definitely that was an amazing experience. I'm like, kind of at a loss for words on it. I could talk all day, I guess, to some degree on that portion of the journey. But what Jeff did was he had a brilliant way of taking very complex situations and breaking them down into easily achievable goals. And I think you saw that in the product that we created at that point. And I think that's one of the PDS speeches.
Yeah.
Where they talked about the journey to the North Pole.
Hurrah.
And the one group that went all the way there and then froze to death versus the one group that's like, hey, we're gonna plan this out and do it very strategically. And that was the journey, and that's the way he led the team and helped grow the people underneath them. And that was a really important thing, was the way he empowered the people underneath to take risks.
Yep.
and to make decisions, and to get out there and then kind of aggregate all of that insight into, all right, let's take all this information and try to make it make sense and make it actionable, I guess is the best way to say it. So, me being in a position to do that with the team, like I'm honored, truly. And, I've been with Outcomes for 6 months now. And the first part of my journey here has been building a new team.
Yeah.
And so, I was just telling somebody a couple minutes ago, like, when I was posting the first jobs that I had open and I had people reach out to me, like I had Mark Amu, who you're going to talk to here in a couple minutes. I worked with him when he was with Bartell Drugs, for 10 years, phenomenal guy. When he reached out to me, I was like, oh, you're hired. Like, I got to do a formal interview process, but like in my mind, like you're hired.
Yeah.
But those are the kind of people, these clinical pharmacists, just the passion just oozes out of this guy. And that wasn't where I started with this journey, but that's the team that I've created. And looking for people that share that vision is like, when they care about community pharmacy, they don't have to be expert salespeople.
Right.
But if they're passionate about this, like truly, like if it's in their heart and they want to help these people succeed, like then the product kind of sell themselves to some degree, because you will find a way to align that with what they're trying to do. And again, Outcomes has an amazing suite of products, and how do we present that in a way that's transparently not complicated? Because I think for a while it was a little bit complicated. It's is it Prescribed Wellness, is it Telepharm, is it RX-30, is it Computer X? And even 6 months ago people were asking me, and well, I'm not entirely sure. I'm trying to figure it out right now. And so we've unified that vision. I think we've really made a lot of headway as far as here's where we're leading with this Outcomes Premium, and the future is clinical. And again, the filling of a prescription, it's still important, but it's not what you're leading with today.
Right.
For years I led with, we got to fill prescriptions more efficiently, and now it's like, we got to do that, but we really have to think about all these other things too. And so where can we look for efficiencies in the pharmacy, with counting technology and IVR and automation? Because first thing most of the pharmacists come to me and say is like, okay, all this clinical med billing, MTM opportunities, it's great. Where am I going to get the time to do it? And so now we got to back up and say, okay, we got the filling portion done, but if we could add in, count technology, how much time does that save? And you try to kind of bake it out and show the ROI of you invest in some other areas to open up your time, because that's time is the currency, right? Like they don't have more time, and we need to kind of find that. So back to the leadership portion, I'm trying to build a team, and I have, that feel the same way I do. And I think we're in a really, really good spot moving forward. And I'll give a shout out to it. Like I owe that to Jeff, because I wouldn't be here if he hadn't given me that opportunity 15 years ago.
And it's like now it's your turn. Like you have to look at the younger generation up and coming, and we have to instill in their hearts that this means something. This isn't just
Yeah.
a job. This isn't just us. We're here to make sure that pharmacists are winning, and that part of that winning is getting paid, and part of that winning is being able to do more for their patients because their patients desperately need them,
Yeah.
because it's the only medical provider that they're seeing 9 times more them per year than they're seeing their own physician. So
Yeah.
this is a mission, and I trust, just watching your career over the years, I trust in you too, because you've been a leader and you've been someone in the space. And congratulations on joining up with Outcomes.
Thank you.
I want to invite you to maybe meet up with me on my show This Week in Pharmacy sometime, so we can talk shop.
Yeah, no, anytime. And I add to the one last point you made. Everything we do, we're looking at what's the trifecta win. So I don't look at any of these situations in the team that we've put together. I don't want them ever looking at like, how do I win? It's the pharmacy has to win, and if that happens, then the patient wins, and then we win every single scenario, because if they win, we win, and
True.
and that's how we have to go into it. And again, we're supporting an amazing community, and I missed being a part of it, so I'm extremely happy to be back.
It's great to see you still here and being part of pharmacy. We're here at ThoughtSpot 2025 here at the Outcomes booth, and we'll be right back. We are back at